In today's session, we'll be seeing how do we plan work and life balance to improve fertility. So, in today's world, especially in cities like Bangalore, we see both husband and wife are always on their toes, running around, trying to achieve the best in their careers. And in this scenario, most of the time they forget about their personal life. They might lose the maximum fertile period of their life, and the infertility is quite common in these kind of people. So it is very important for one to balance both work and life so that they can achieve maximum fertility. So how do we do it? How much impact does this work has on our life, day-to-day life, and the reproductive health also? So, because of this excessive work and the career ambition, we see many women these days put forward the career first, and then they plan their family a little later, or plan for the reproductive things a little later. So, by doing this, without their knowledge, or one of the most important thing that they're going to miss in their life is the ovarian reserve. So, as the woman ages, the a number of eggs in the ovary keeps on reducing, and the number of eggs in the ovary is a prefixed number right from her birth, and it reduces right from the beginning, and the reduction rate is much faster once the woman crosses the age of 30 to 35 years. So once the egg reserve reduces, there is no treatment to increase the number of eggs in the ovary. So one has to plan their pregnancy earlier the better, and simultaneously should plan for her career as well. So, how should a person balance all these things? One, choosing the right, knowing her priorities first, choosing the right work. In spite of that, she wants to be a career-oriented woman. She feels a family would become an hindrance, or if she's planning for a pregnancy right now, might affect her career. So, the various options these days that is available, like one can plan for oocyte freezing, where we know that ovary is not going to wait for anybody. So, at the before 35 years, if the woman comes to a fertility clinic, we check for her scan. We can do a scan for her, see her ovarian reserves, and check her AMH levels, and then plan if the AMH is on the borderline, or her egg reserve is on the borderline. We feel it's going to reduce in few years, where she cannot plan for her pregnancy due to various reasons. She can undergo ovarian stimulation, remove all the eggs, freeze it, and keep. And later on, once she's settled, and then can come back for her pregnancy. So this helps in giving her a mental peace, and not work with the fear that her fertility might get affected if she keeps on postponing her pregnancy. And second most important thing that we see these days is stress. Yes, stress is becoming a big major factor that affects fertility because of various impacts it does causes. It's not just it affects fertility. There's other things such as one might develop sleep disturbances, that they develop a lot of unhealthy food habits, and use of more coffee to beat that stress, more of alcohol consumption. All these things put together brings about a hormonal imbalance in both men and women, which will impact greatly on her or him reproductive health. Because of stress, especially if one undergoes too much of stress because of work, and there is the change in her sleeping patterns, then the hormonal changes do happen in the body. There could be changes in the estrogen levels, which can affect her ovulation time, because of which the cycles can become irregular. There's possibility of some cycles may be anovulatory, and all these things directly affect her chances of pregnancy. So one needs to balance it quite well, and avoid doing certain things like planning for stress busters, like performing yoga or going for meditations, doing sport activities which will keep them fit and healthy, as well as will help in reducing the stress. Both men and women can get into these things. Plan their work properly, plan the day ahead, take a day or two off, give some time for family bonding, and plan the pregnancies as early as possible. Simultaneously look for a job which is more flexible and it's not going to affect their life. So by doing all these things, one can balance their both work and life so that it should not affect their fertility. In men also, we see that because of stress, too much exposure to Wi-Fi, there is increasing male infertility, which is on rise, which we see almost about 45 to 50% of infertile couples do come with male infertility. So because of these reasons, there could be the chances of reduced count, reduced forward moving capacity of the sperm, that's called sperm motilities. And we also see increased DNA fragmentation, especially those who are excessively stressed, smoking because of the stress, excessive alcohol consumption to come out of the stress. So all these things will have an impact. So it's very important for one to balance both work and their life to achieve a good reproductive health. Thank you.